Welcome to the Healing Trauma Podcast, a space for those who are healing from complex and developmental trauma. Introducing your host, Monique Coven, a certified trauma recovery coach, survivor, and thriver. The intent of the podcast is to provide helpful information with insight that can validate, encourage, and support you on your healing journey. You're going to hear stories from other survivors and trauma experts, featuring therapists, coaches, and practitioners. We will open up the conversation on effective trauma healing modalities, practices, and tools. If you are interested in trauma recovery coaching, as well as recommended books and healing resources, head over to www.thehealingtraumapodcast.com. And now, here is your host, Monique Coven.
Welcome back. On today's episode, I'm sharing a conversation that I really enjoyed with Dr. Tamara McClintock Greenberg. And Tamara, she's a clinical psychologist, and she's the author of many books. And the one we're going to be focusing on today is her workbook. It's called the Complex PTSD Coping Skills Workbook. So we're going to be talking about this concept of, as she sees complex trauma as an identity theft. And I found that very interesting. And we're going to talk how that sort of applies to trauma survivors, especially when we've had repeated childhood and early childhood trauma. And we're also going to be talking about coping strategies and things that can be helpful in the present so that we can have a little bit more joy and feel more connected to our life and to ourselves and others. So now, on to the episode. Hi, Tamara. Welcome to the podcast.
How are you?
I'm good. Nice to have you here.
Thanks for having me.
Yeah. So we're going to talk a little bit about your book, which is called, it's a workbook, and it's called The Complex PTSD Coping Skills Workbook, an evidence-based approach to manage fear and anger, build confidence, and reclaim your identity. And I love workbooks because I like to have something to do on my own. It gives me a chance, without like a therapist in my presence, to really think about things and to process things. So I love that. And there were certain things in here that were a little bit different that I liked, that maybe we could bring up here and talk about with regards to, you start off with seeing trauma really as a theft of your identity. And that's really interesting. So maybe we could start there.
Absolutely. Yeah. I mean, and I agree. I really tried to make this workbook something different, than what was already out there. Don't get me wrong, there are a lot of great books and workbooks on trauma and complex trauma. But I think that, I come from a middle class, lower to middle class background, wasn't raised with privilege, had a full scholarship for graduate school. So I think everything that I learned as a psychologist and even in college, I always had to translate through a different kind of filter, and so for me, when I think about a lot of the approaches for complex trauma, I was really trying to figure out ways to make things a little bit more user-friendly for clients, to give them a little bit more control over the process of their treatment. Because one of the things, and I'll get to identity theft in a second, but one of the things that I think is been challenging for survivors of trauma is that a lot of times therapists will have just one or two techniques that they give to everybody who comes in the door without really thinking through, well, does the client want this? Can the client tolerate this? in my field, we've become a little bit religious, if you will, about people having, their one or two theories that they abide by, and they don't do other things. So for me, one of the things about this book was that I really wanted to make it an opportunity for people to have a lot of different options for healing. And to your bigger point, and the bigger point about identity theft, is that is really the harshest thing for me about complex trauma, is that it robs us of our identity. Even if you have a good career or a partner and one's life looks, ostensibly good from the outside, it doesn't mean that people feel satisfied and whole internally.
Totally. And I think that's one of the things many of us realize at the very beginning. I'm like, okay, so like I've got what I thought was going to create that feeling of safety and security in me. Why do I still feel like I'm still a child in trauma? Doesn't make sense.
I know. And exactly. And so I think the big thing about the identity theft, and this is probably a slightly novel way to think about things, but it makes the most sense to me. I think the biggest thing about identity theft is because, again, a lot of us can sort of find our ways in our careers and be happy-ish, right? But I think it's this, what I call outsourcing. It's the way that we outsource our thoughts to other people. So in other words, trauma survivors are often incredibly gifted at figuring out what other people want from them. And that is a great skill, because you need that in order to get through really difficult things, right? You have to be able to give certain people what they want in order to minimize, the impact of the damage that, is going to occur. But we can get a little bit too good at that. And by being too good at that, we can sort of forget, well, wait, what do I want? What do I need? And so it becomes this sort of like, an ongoing sort of process of outsourcing that just gets more and more powerful as we age, almost to the point sometimes where we become shapeshifters, like, who do you want me to be? And I'll be that person. And it robs us, again, back to the identity theft, it robs us of our own agency, because again, it's you can have what looks like a great life, but not feel like you own it. And I think that where the rubber, meets the road in terms of that is how things are in our relationships. Can we set limits? Can we be assertive? Can we know what we really need? Can we feel entitled to say what we really need? And then if we don't get it, how do we handle that? So all of those things for me kind of get encompassed in this idea of identity theft.
Yeah. I mean, what you were saying at the beginning, so true. If we grow up in an environment that's unsafe very early, our whole identity becomes formed towards survival. And so it's like you said, it's outsourced. We're like looking, okay, how are they behaving? How are they reacting? I got to figure that out. And so we just can totally lose touch with who we are. So no wonder why when we get older, we're like, we don't really know what we want, who we are, or even how to ask for it.
Right. It's kind of like, the one way I think about it is, it's kind of like hypervigilance, right? Which, everybody has if they have a trauma background. But then it's like the way hypervigilance becomes a cognitive style, because then you're just sort of like looking outside for everything. And in my field, we've really pathologized that. And that bothers me a lot. We call it externalizing, and we make people feel terrible about themselves. But really, it's so adaptive if you think about it. Like, that's the way hypervigilant works. You can't pay attention to what's inside because you have to keep an eye for all of the terrible things that could happen outside.
Yeah, I love that. You said a couple of things in the book that was just really good to hear from a psychologist. One of the things you said was, I mean, it's what you're saying now, which is helping us make sense instead of pathologizing what is completely normal. But you said something that really warmed my heart. You said something like, it's starting to change where our field is starting to understand about complex trauma, though it's slow. And then you said, we really did, I don't know what words you used, but maybe you could say the words you used. What did you say? It was so helpful to hear.
I think I think what I said is that we've done a disservice to clients by making them feel that there's something wrong with them. And I really do, and not everybody agrees with what I'm about to say, but I really feel strongly that personality disorder labels are a mistake. I think that we can understand people without having to give them these labels, which quite frankly, statistically don't really hold up anyway in terms of how we measure the accuracy of diagnoses. So we have definitely let people down by implying that there's something wrong with them. Now granted, I'm not trying to advocate a position of, everything that's been done to people absolves them from responsibility, right? I mean, we all have to be responsible for our own lives, but there's this attitude, I think, that people in my field have had towards trauma survivors, which has made them feel terrible about themselves.
Yes, yeah, definitely. And it's that disorder word, personality disorder or complex trauma disorder, anxiety disorder, when there's actually, these are reactions that are not, they're normal considering they're a normal response. So I really like that you acknowledged that, which felt good. I don't think I've ever heard someone say that. It was like, oh, they're taking responsibility, even though you're probably too young to even whatever, but it still was nice to hear. Healing from trauma can feel complex and overwhelming at times. So many questions and so many modalities. Sometimes you just want a safe space to bring them to and talk about the healing journey. If you'd like to meet for a one-to-one consult with me, you can visit my website at thehealingtraumapodcast.com. The other thing I noticed about your book too is that you're really you're talking about helping people manage symptoms, what we live with every day. So maybe you want to talk a bit about that.
Yeah, well, no, I think the thing that's probably a bit different about this workbook is that I really, really try to go into the idea of anger and fear, because I think, again, if you've had trauma, you're going to have a lot of anger and a lot of fear. And who wants to feel those things? I don't. You know what I mean? So we all are trying to get rid of these emotions. And so I really, and I think concepts related to dealing with complex trauma, such as DBT, dialectical behavior therapy, for example, and a lot of approaches, they encourage, affect, or what we call emotional affect regulation, emotional modulation, right? And I think those tools can be really useful. However, I worry that we don't want to give people the message that they should get rid of their anger and their fear because I want people to learn from them. Because I think the road to healing isn't just, again, because if you think about it, it's a little like mini re-traumatizing, right? It's like, well, you're angry, don't be angry. It's like, well, okay, well, how about we just think about what the anger means and try to be really curious about it and think about it in a neutral way. Because the thing is particularly people who have, quote, so-called anger problems, they are remarkably unassertive in their personal lives. They have so much trouble actually setting limits. And so my whole thing is I just feel like we've judged people very harshly in my field. And particularly when it comes to anger, I think that's one way that people have really been judged. And get this, it's the weirdest thing ever. If you look at papers on trauma, about 2% of them, PTSD specifically, 2% of papers in my field on PTSD deal with the issue of anger. So we aren't even really talking to people or thinking about the issue. And anger is a criteria of PTSD. And so it's sort of another way we've let people down is we're not even thinking about this big thing, which is an issue for all of us. We all have to figure out, what do we do? And especially as women, we don't really get any good messages about how to deal with our anger. So I think, one thing I really try to focus on is fear and anger. I think in particular in our relationships are always a big part of our lives and always a big part of our struggles. And of course, the other things are difficult too, severe anxiety, severe depression, and it's not, and I address those things too, but I think what is more novel about my approach is really leaning into fear and anger, because I think those are the things that underlie a lot of the other symptoms that we see for people with complex trauma.
So you're saying like unexpressed anger?
No, it's a great question. It's not necessary. That's an excellent question, because a lot of times people will say, well, so do I just tell the person I'm angry? And it's like, not necessarily. In fact, I think 90% of us dealing with our anger is internal, because not everybody can hear that we're angry. Sometimes it doesn't do any good. Most of the time people don't want to hear it. And so we have to think about, okay, well, it's always a risk benefit calculation, right? Because if you're going to express an emotion to somebody else, that's a big risk. And so you want to be thoughtful about, is this worth, my energy, to try to have this difficult conversation, and really thinking realistically about, is this something I can work through myself and try to understand that my anger is about the present, but it might also be about the past? Is it partly that I don't want to feel my anger, and so I'm going to tell someone I'm angry in order to just sort of outsource my anger, kind of get it out of me and into someone else, right? And so it's partly about expressing it. It's partly about learning how to be assertive when we need to, but it's also, honestly, it's more about just feeling entitled to be assertive. That's more the issue. And the example would be something like, I don't know, something totally simple, that you're in an Uber and the guy's driving too fast and you're scared, and you ask him nicely to slow down and he doesn't, and he drives even faster, and then you start to get really scared and really angry, and you start screaming at him. And then afterwards, you feel like you've done something wrong, when really that was just a normal response to a dangerous situation. But trauma survivors will feel very terrible about a situation like that. They'll feel like they've done something wrong. And so one of the things I talk about in the book is, don't feel bad if you get baited into a situation where you get angry, but at the same time, leave a situation before you end up being angry in a way that makes you feel bad about yourself. Does that make sense?
Yeah, it does. What was coming to my mind was just learning to befriend anger.
Yeah.
Learning to befriend anger. But a lot of people, again, have made the connection between, anger is what I experienced in my childhood with that caregiver, and I don't want any part of that.
Exactly.
But I think this is where it can be helpful to, discuss it, work with it with your therapist in a safe space.
Yeah, absolutely. And finding a therapist that, can think about anger in a neutral way.
Yeah.
Again, people in my field, we aren't really good at thinking about anger, which is interesting if you think about it.
Mm-hmm.
I mean, I think a lot of us go into the field because we don't want to have any bad emotions. We want to help other people get rid of their bad emotions, quote, bad emotions too.
Yeah. Wow. The other thing, there was a couple of things that I wanted to talk to you about, but one of the things I think can be really helpful for the listening audience to just hear from you is you really make a difference. You talk about the difference between PTSD and CPTSD, or complex trauma. Can you tell us the difference between the two?
Oh yeah, absolutely. So primary, what we now call primary PTSD, we used to call it simple PTSD, but it's obviously not simple if you've been through it, right? So we call it primary PTSD. Now, primary PTSD is when you've had one or two really traumatic, sometimes life-threatening events, often as an adult. And the events cause significant, difficulties, like all the things you think of: flashbacks, nightmares, feeling numb, hypervigilance. And when we think of complex trauma, You've referred to developmental trauma, and you're absolutely right. It's trauma that starts in childhood and then continues into adulthood often, because there's a lot of reasons of understanding how people traumatized as children are more likely to be victims, as an adult. But the simplest way to say it is that, trauma kind of begets trauma. Traumatized folks just end up, sometimes it's just a matter of being in the wrong place at the wrong time, but it happens more frequently. So it's the aggregate of a difficult life. And so you have all of the symptoms of PTSD, right? Like I said, nightmares, flashbacks, feeling numb, hypervigilance, but you also have the identity theft that I spoke of, right? But things like dissociation, which is a tendency to leave during stressful situations, and often chronic suicidality, difficulties finding meaningful relationships, sometimes substance use, sometimes eating disorders too, actually. The other things that go along with dissociation are things that we call like derealization and depersonalization, which are basically, it's a feeling of just being outside of yourself, not being in your own life, which can be incredibly uncomfortable. And those symptoms, by the way, particularly depersonalization, feeling like you're not in your body, or you're not sort of connected to your identity, that is more common actually in betrayal trauma. And so betrayal trauma, very similar to developmental trauma, right? Where it's when a trusted caregiver hurts us, not a random stranger, but somebody who we need on a daily basis. So, and betrayal trauma, quite frankly, is a predictor of more severe complex PTSD symptoms, for obvious reasons, I think.
You also were saying, I mentioned this earlier about, how it wasn't recognized when people would come in with complex trauma. It would be like, no, you don't have the one or two, so you have anxiety or you have something else.
No, that is such a good point. And actually, Judy Herman, who I know you had on recently, this is actually her idea, from her first book, that a lot of times clients don't connect their current difficulties with past abuse, which I think is like, when I read that, I'm just like, oh my God, that is so true. And so I think the thing to remember is that clients can come in. I mean, I can't tell you how often this has happened. Clients come in and they're like, basically, I'm so screwed up. I don't know what's wrong with me. I don't get along with my boyfriend, blah, blah, blah. And then they'll say like, oh, well, yeah, I had this horrible thing happen, and this friend died when I was a kid. And, I had this horrible medical illness, or whatever it is. And they don't link those incidents with their current struggles. And I think that, it makes it harder for therapists, right? Because they often rely on people being able to come in and talk about the narratives of their lives, which leads me to another, I think, really important point, which is, I think one of the struggles, another struggle for folks in my field is, I think we have tended to imagine that clients are just like us. So a lot of us in my field, we're anxious. We want to talk about our histories. We want to talk all the time. We have a lot to say, and we want someone to listen, But the thing is a lot of people, particularly people with complex trauma histories, they don't understand that they often don't even know sometimes that they have this thing, this sort of identity issues and personality theft because of their traumatic background. They also don't know how to talk about it. So the old teaching for a long time in my field was, you have to help people develop a narrative. And it's like, well, what if the narrative is like really disjointed and they don't remember, right? I mean, I know a ton of people who don't remember anything until after high school, right? Or they, and the memories before that are just so blotchy. And then so we expect people to come in and to tell us what went on in their childhoods. It's like, dude, that's not even possible for a lot of people. So I think, really trying to sort of be mindful that we can just kind of work in the here and now and focus on current relationships, I think is really, I got kind of far afield from your original point there, but I think is another really important, part of how I think about working with people with complex trauma.
Yeah, it is so interesting that there are so many different approaches, as you said. And I think you talked about in the book, like the first portion being really focusing on the here and now and coping strategies to help you in the here and now, and getting curious about your responses and anger and things like that, relationships. You don't talk about really the second part of, I guess, the processing after. But one of the things I noticed is that some people I've noticed may choose to go on at some point doing more deeper work, more processing. But I've seen people who have been really happy just getting the first part because they've never known what it feels like to understand what's happening, to feel safe, to start to feel safe, to have coping skills.
Right, exactly. Yeah, and I definitely don't dissuade people from, people call it different things. You could talk about doing quote memory work or even exposure therapy, right? Where you're kind of encouraging people to remember things while helping them stay calm while they do. I'm not against those approaches, although I should say exposure therapy has a fairly high dropout rate of 40% in some studies. So, but I think I agree with you that I think for a lot of people, just feeling in control of one's life is huge. And I always tell people, if memories come up, we will deal with them organically. But when you're feeling safe, you have to feel safe in order to think about difficult things. And so stabilization is like the top 10 things that we do, right? And then, and in addition, in the here and now, we're always being triggered by our current relationships. And so we can also talk about current relationships without having to go too deeply in the past and still, work through some of those emotions, I think anyway. Because my number one thing is, I don't want to say like, well, in 10 years, you can start your life once you've worked through all these memories. I want people to have tools, right? I mean, you want people to have tools to feel better now. And then if they want to stay in therapy and keep talking about stuff and thinking about stuff, great. But let's get you happy-ish, as happy as any of us can be, right? But happy-ish first,
Trying to remember in the book that I really like. Oh, yeah. You talked about the difference between, and again, it's generalizing, but still, people who have had complex trauma versus people who haven't, and how they see the world or how they are in the world. I really like that.
Yeah.
Could you talk a bit about that?
Yeah. No, I mean, people without complex trauma histories, they have a completely different experience of the world. They feel entitled to have good things. They don't feel guilty when something good happens. They don't feel anxious when something good happens. They have no problem setting limits in relationships. They don't even think twice about it. They don't worry that they're too much for other people. It's nice, I would think.
I'm thinking like people are like, really? And really, and I mean, I know people like that, and it's really nice. But those of us who have been so preoccupied with being concerned with other people's emotional dysregulation, we never really learn to think about ourselves and yeah.
Well, exactly, because I think part of the issue is that it works to some extent, right? Like being sensitive to other people can make you a great podcaster. It can make you a great therapist, doctor, lawyer, right? I mean, all of these things, I think they can be strengths. It's just that we lean on them too much, and then they become a habit that we have to learn how to, and it's so hard. It's so hard to not be completely attentive to someone else. And it's also so subtle, right? It's like, your partner comes home and it's like, again, somebody not without a trauma history might not even notice that the person is in a slightly less good mood than normal, right? Whereas if you have a trauma history, you're on high alert, like, oh God, what's going on? Well, they might have just gotten stuck in, but you're like, holy shit, everything's going to fall apart.
Exactly. Yeah. So is there anything that you want to share before we close? Here's your chance.
Yeah, no, I mean, I think I'm happy. I've written a few things, a few books, and I've never been this happy with a book. So for whatever that's worth, like, I'm fairly critical of my writing, but I really love this book. I feel very passionate about it. I feel like I've been doing this for almost 30 years, so it is kind of my voice of, this is what I've learned, both as a patient, right, and as a therapist. And this is what I think is the most genuine way to help people. And there's a lot of great tools in there, some of which, have been talked about before. But I do think my spin on some of this stuff is a bit different. And I think that, and the feedback, quite frankly, has been that there's something really authentic feeling about the book that people liked a lot. And it's soothing, I think, for that reason, So, I wish I would have had this book 30 years.
Absolutely. I mean, it's just so wonderful to just have this at our fingertips now. So yeah, really appreciate it. Sorry, that's my dog, and he's agreeing with me.
Oh, I didn't even hear. I have two right here too. Two dogs.
Mine sometimes shows up in podcasts. You'll hear a little, but I love having him near me. So that's great, Tamara. I will put the link to your book in the show notes. People want to look for it. And thank you for this conversation.
Yeah, it was really, really great to talk to you.
It was great to talk to you.